you have to get your neck addressed, and you have to get the right kind of care for your neck. Hey everyone, Dr. Kevin Leach here. Today we're talking about headaches from the neck. So this video, I'm going to do my best to just break down why chiropractic care and fixing the neck can help with headaches. Now, this is not a video on research. There's plenty of research out there that supports this. I'm going to link Haldeman's research that you can dive in further if you want to know the data. But this is going to be based off of my observations and experience based on what I've seen clinically in my 17 years of experience and taking care of patients, and what makes sense in regards to the physiology and function of the spine and how that relates to headaches, migraines, neck pain, and many other things. Well, the many other things will be for a different video, but this is going to be for headaches specifically. So this essentially, this whole idea for this video is to get across to headache patients. If you have headaches, if you have chronic headaches, it's not just from a sinus infection or you didn't drink coffee today. If you have chronic headaches, or you're just a headache sufferer, you're a migraine sufferer, it's highly, highly, highly likely that it's coming from your neck and it needs to be fixed. So that's just the must know for you to understand. If you want to get help with your headaches and migraines and not take medications, then you have to get your neck addressed, and you have to get the right kind of care for your neck to improve two things. The two mechanisms on a very basic fundamental level of headaches caused by your neck is alignment and range of motion. Okay, so range of motion probably doesn't make too much sense, but when we look at our body and how it's supposed to function, it's supposed to function as normal. We're supposed to just feel good, feel healthy. If we don't, there has to be a problem why, and the reason why. And the problem is in the spine, in the upper neck. Okay, so if you have a misalignment of these bones in the neck, it's going to cause dysfunction. Now, there's plenty of different ways that this misalignment causes dysfunction, and the details of the neurological reasons why it happens is, again, that's more detail for another video. You can let me know if you want me to go into that. I'll happily make a video on that. I will likely make a video on that, but it's not for this video. It's just to understand that your body and your joints and your spine and your nervous system, it's designed to detect problems. When it detects problems, it tells the brain there are problems, and it does that through pain. That is the fire alarm going off. That is the mechanism your body uses to say, hey, something's wrong. Your body is not going to just be bored and decide to have a headache one day or have a migraine for a week straight. There is something going on in your body. It's not just genetic. You might have a genetic predisposition because your family has it, but there's still a reason why it's happening, which can most likely be addressed and caused, but the cause can be addressed. So, and we'll go over that in a second here. So here's the treatment aim for my patients and for what chiropractors are doing for these kinds of patients. The treatment aim is to achieve normal function, not decrease pain. Obviously, we want to decrease pain, but if that's the treatment aim, we can do that with medications, drugs, other kinds of things to decrease pain. That stuff is available. But if we want to actually restore normal function and thus normal nervous system function, that's how we're going to achieve the body being healthier and not having headaches and migraines, or at least decreasing them over time and significantly. So that's the treatment aim. So the results will depend on chronicity and your damage to the spine. So when people ask, hey, well, how, am I going to feel better immediately or over the long run, etc., we don't know. A 15-year-old is going to respond differently than a 65-year-old. That's just normal. That's understandable. Now, on top of that, is the structure of the spine. Is there damage to the discs, to the joints? You can have a degeneration process of the what's called the facet joints inside the spine. You can have disc degeneration, bone spurs. You can have a lack of normal curve. There's all kinds of things that will inhibit your progress forward and how much better you're going to get because of the treatment to restore normal function. Again, coming back to foundation, we want to restore normal function. If we restore normal function of the spine and the nervous system, your body will have less reasons to give signals to your brain, which is pain, that something is wrong. That's the fundamental thing to understand here. So, chronicity means how much time have you had this problem? How much time has it been there? Have you had headaches and migraines for 40 years? Well, we might not be able to get 100% better. But we will optimize, that's the key word, optimize your spine and nervous system function to get it to where you have the least amount possible. If we can get it optimized, that will be the best possibility for you to naturally, without drugs, to get to the point where we're managing them from a conservative standpoint. So that's chronicity and that's damage. Now, what are the causes and how can we prevent these things from happening? The causes is essentially trauma. So you fall off the jungle gym when you're 5. You have a car accident when you're 15. It's a little fender bender, but it still causes some damage in your spine. Countless times I've had patients report, I had an accident 5 years ago, and then a year later I started having all these problems, or 6 months later I started having all these problems. Your spine will develop normal, healthy, and naturally if there are no outside factors that cause a problem in the spine, and that's whiplash, that's slipping and falling on the ice and smacking your head. That's any sort of damage to the neck. Small damage can compile and cause issues almost immediately or even over time. That's how these problems happen. So the idea here is that, and people don't want to hear this, but I don't care. I'm done not spreading this message and this idea. Is we need lifetime care. I used to say we don't need it. It's a choice, but everybody wants to be healthy and as healthy as possible. If you want to be as healthy as possible, you need chiropractic care. You need precise, proper chiropractic care. You need treatment to the spine to remove misalignments. We call them subluxations, and restore normal function. If you don't want to be healthy, then don't get that done, right? If you don't want to be healthy, you don't eat your veggies. Okay, this is a choice, but if you want to be optimally healthy, you have to take care of your spine, and you have to do that from day one. From day one. This is, do you take care of your teeth from day one? Well, we don't have teeth at day one, but you get the idea. Where we want to give the body the best chance to be healthy from day one and moving forward. So we want our spine checked from day one. We want, they say in chiropractic, as the twig is bent, so shall the tree grow. And if you don't have a properly functioning spine throughout learning how to walk, falling off the jungle gym, playing contact sports, getting into minor fender benders, etc., as we go through life, if you don't optimize your spine and make sure it's healthy, it's going to grow into a worse state than if you have it aligned as you grow up. Okay, so it's I always say this is the same as dentistry. You know, you're going to get your teeth checked, you're going to take your child to get the teeth checked, you're going to take care, you're going to have dental hygiene. You want spinal hygiene as well. You're never going to go to the dentist. That's one of the stigmas with chiropractic, right? It's like, oh, once you go, you have to go for the rest of your life. It's like, no, you don't have to. Just like you don't have to go to the dentist for the rest of your life. You don't have to brush your teeth. You don't have to floss your teeth. But if you want to take care of your teeth moving forward in your life, you're going to do that. If you want your spine to be as healthy as possible moving forward in your life, you want to take care of your spine. And there are things you can do on your own to take care of your spine, and but there's no removing the expertise of a trained chiropractor, making sure your spine is removed of all interference and removed of all subluxation. So I think that's all as far as what I went over here. If you have any questions, let me know. This is crucial. This is absolutely important to understand if you're a headache sufferer, if you're a migraine sufferer. you can, I mean, obviously you can come to me. You can find other upper neck chiropractors or traditional chiropractors anywhere on the internet. You can ask me wherever you are. uccnearme.com is a place to find upper cervical chiropractors. If you have any questions, let me know. If you want me to do any more videos explaining anything that I just talked about here, please let me know. I'd be happy to do so. We'll see you next time.